Hi, I'm Jonah Essers with the Tummy Handbook. Welcome back to my series of videos on food allergies in infants and toddlers. We've already covered a wide array of topics on basic tools and tips for managing food allergies in children. In this video, we're going to cover what to do if the basics don't seem to be working. So as a parent, if you've watched your child get sick from food, they've got blood in the stool, they've got tummy pain, they're vomiting, they've got irritated skin, you can't help but wonder whether we potentially need to go above and beyond the basics, whether it's time to escalate care. And that's what I'd like to discuss with you on this video. And first, let's highlight the most important thing, which is when to recognize an immediate, potentially life-threatening reaction, which we often call an IgE type of reaction, an eruption of hives across the body, listlessness or decreased interaction, difficulty breathing, wheezing, cough, shortness of breath, potentially excessive vomiting. For these signs or symptoms, you potentially want to visit an emergency room. So what a lot of families will do is they'll start heading to the emergency room, and they may urgently call their primary care doctor on the way over to get advice to make sure that it's the right thing to do. So outside of an immediate reaction, the other reason to visit an emergency room would be potentially if your child might be dehydrated. And dehydration can come because your child is not eating as much as they should because their tummy hurts. And it might be because they have excessive losses. They're vomiting too much or they have too much diarrhea over a period of time. What does dehydration look like in an infant or a toddler? In a couple different ways. Number one is you might see decreased urine in the diaper. You might see cracked or dry lips or mouth. If your child has a fontanelle, which is the little hole around the skull that you see in infants, it might be sunken down. They might act listless or less interactive. They might have doughy skin, and they may cry with less tears than you normally see. So for any or all of those signs or symptoms, you again might consider an emergency room with a call to your primary care doctor on your way. In an emergency room, you might get IV fluids, which will often rapidly replace fluid, and you'll have a doctor look over your child to make sure that everything is okay. So we've discussed potential emergencies that need to be addressed. Now let's talk about progression in symptoms. So you've already made some changes. Mom's removed some foods, you've switched to formula, you've removed some table food, but progression in symptoms would suggest that it's time to escalate care. So for example, you might see that the skin is getting worse. The skin is now so irritated that your child can't sleep, is fussy all the time, is scratching the skin so bad that there's skin breakdown and now there's bacterial infections in there. Those would be reasons to escalate care. Additionally would be vomiting is becoming worse, vomiting to the point where it's interfering with comfort and the ability to feed, is maybe causing dehydration. For those reasons, you may consider escalating care. Next would be worsening tummy problems like blood in the stool. If that becomes more excessive, you may want to seek out a higher level of care. And lastly would be other issues with the tummy, such as increased diarrhea, increased output, increased tummy aches to the point where your child isn't comfortable. All of those would be reasons to do more than you're doing already. So we've discussed emergencies, we've discussed progression in symptoms in spite of some basic attempts with changes to the diet. Let's talk about some warning signs or red flags. Number one would be poor weight gain or weight loss in a child, which is never okay, never healthy, and would suggest that either your child isn't eating enough because they're so sick, or the intestines are so inflamed that they're having trouble absorbing nutrition. That would be reason to do more than you're doing already. Next would be if you see a really exhausted family. So if you've got a breastfeeding mom, they've removed so many foods from their diet that they're malnourished or they're potentially exhausted. Sometimes nobody's sleeping in the house. There's a lot of stress in the house. And those would be potentially reasons to make a change to do from what you're doing already. And lastly would be some sort of progressive food refusal in the baby. And often babies will start refusing food, and that's either because their tummy hurts so much, they're in so much discomfort that they simply don't want to eat. The other reason would be is that if you have so much inflammation in your food pipe, in your esophagus, that it really hurts to swallow. And that would be potentially a reason that your child would stop eating. So we've discussed emergencies, we've discussed progression in symptoms, and we've discussed red flags or warning signs. Let's talk about what your options are if you think that your child is doing worse in spite of attempts to help with the food allergy. All of these you should discuss with your primary care doctor in advance. Number one would be considering temporarily withholding breast milk if your child is consuming breast milk. As a pediatrician, I try my best to withhold that recommendation to try to preserve breast milk whenever possible. However, sometimes, in spite of multiple food eliminations, it does make sense to remove breast milk temporarily to get some relief. Next would be to consider advancing the type of formula that you're using. So if you've used a partially hydrolyzed, a partially broken down formula, you may want to consider advancing that to an amino acid based formula, which is a fully broken down formula and much less likely to cause a reaction. Next would be to consider treating the skin aggressively with topical steroid creams. Lots of families don't want to go to steroids if they can avoid it. However, if nobody's sleeping and the skin is breaking down and everybody's irritable because of it, steroid creams can make sense. Next would be is if you haven't been to an allergist, it would make sense to go and see one. And we did discuss that a lot of these symptoms are not IgE mediated, and often an allergist isn't helpful. However, if things have really gotten bad, it does make sense to go and visit one just to make sure you've dotted your I's and crossed your T's. If you already have an allergist, you may want to revisit to see if additional testing is necessary. And lastly, consider referring to a pediatric gastroenterologist. And when people come and see me, I often consider trying antacid medications if this situation warrants it. Often I will consider an upper endoscopy, which is a test where we put the baby to sleep with some sedating medications and put a fiber optic camera down into the esophagus and into the stomach to take samples of the bowel to make sure that we have fully uncovered what could be going on in there, which will inform what type of medications we can offer you. Often we'll need to consider putting in a feeding tube to help get nutrition in the appropriate way. And sometimes we have to admit a child to the hospital to really fine-tune their plan and optimize exactly what we're doing. So in summary, there are multiple reasons to consider escalating care. First, if your child is having an emergency, you may consider an emergency room. Additionally, if your child has progression in their symptoms in spite of best attempts, you may want to consider escalating care. There are some warning signs like weight loss, progressive food refusal, and high stress in the house that might suggest escalating care. And ultimately, the interventions that we do potentially get aggressive relatively quickly. So be sure to start with your primary care doctor to map out a plan of attack in advance. Thanks again for watching, and as always, please leave me a comment in the section below if you have any questions. Check me out on Instagram on my link below, and thanks again for watching.